This is your guide to best work with your hospice company and your hospice team. So this video is going to contain what you can expect and not expect from your hospice company, what a hospice admission is going to look like, and how you can best utilize your hospice team. So what can you expect from your hospice team? I'm going to go over a brief generalization, but generally speaking, this is what you can expect. You can expect to be given a 24/7 phone number that you can call day or night, any day of the week, holidays, weekends, 2 in the morning. And a nurse or someone should be answering that phone and possibly sending a nurse out to visit you if needed. At bare minimum, you should be expecting at least one nursing visit per week. Of course, you could be getting much more than that, but technically per Medicare guidelines, one visit a week is the bare minimum. Every hospice company should offer CNAs, so certified nursing assistants, to be coming at least once a week or more to help with bathing and hygiene. You can expect a social worker and a chaplain to be part of your hospice team, and I would really encourage you not to refuse their visits. Every hospice company should have a volunteer program, and they should offer if you would like to be part of it. This is when a volunteer helps you out in some way, whether it's ordering supplies, ordering medications, coming over and sitting with your loved one who is the patient. They are not allowed to touch or care for your loved one who's on hospice, but they have different programs to help in different ways. You can expect your hospice company to provide medications, get the medications delivered to your home, provide equipment, get the equipment delivered to your home, and provide certain supplies that should be delivered as well. As far as like what kind of medications and what kind of supplies, that is really going to differ from patient to patient, hospice to hospice. It just all depends, but they should be able to supply you with medication and get them delivered to your home. That's the big take home here. This is what you should not expect from your hospice company. One big thing I always say right up front, you cannot expect custodial care. What is custodial care? Custodial care is what most people need, which is someone to be there day in and day out, caring for the daily needs of your loved one. If your loved one's going to be in-home hospice, not going to a facility, the family is going to be caring for that person. I would say it's like 80-20. 80% family caring for the person, 20% hospice helping. So you should not expect a hospice company to be providing custodial care. You should not expect a doctor visit all the time. The doctors work very closely with the hospice nurses. They are very involved in your loved one's care, but you will not be physically seeing them. At least not a lot. So the doctors will make visits, but they are few and far between. Here are some things that fall under custodial care that you as the family member or caregiver will be expected to do if your loved one's in home hospice. You will be giving medication. You will be changing them. You'll be cleaning them. You'll even be doing wound care sometimes. So a lot of this care that families think the hospice nurse is going to be doing, we do if we're there making a visit, but we will be expecting the family to take over that care when we're not there. So like I said, it's going to be a lot of work on the family, and that is something to be expected. No hospice will be offering that. The one time hospice companies can provide 24/7 care, which is possible, is if they start something called continuous care. Now, continuous care has a lot of rules and regulations that the government, Medicare, is telling us to follow. The main reason we would start continuous care, really the main and only reason, is if there are symptoms that are out of control. So we would never start continuous care if someone doesn't have a caregiver or if someone's family isn't comfortable giving medication. That is not an indication to start continuous care. The only time we are legally allowed per Medicare guidelines to start continuous care is if there is a symptom, for example, pain, that we've tried X, Y, and Z at this visit, meaning we've tried to give morphine. We waited for 30 minutes. The pain is still at a crisis level. We call the doctor, we get things switched up, we try something else. It's still at a very high level. Once we've done a few things at the visit and we've noticed like, hey, this is not working, this person's having a pain crisis, that is a legal Medicare reason to start continuous care, meaning we can get a nurse to be with the patient and the family for 8-hour chunks of time to get this symptom managed. Let's say that this nurse, the continuous care was started, and then by the next morning at like 11 a.m., their pain is now controlled and they've had a controlled pain level for 4 hours now. That would indicate that the continuous care is no longer needed and they would pull the continuous care nurse out. And then they would resume back on regular nurse visits. So that's the only time that we can do 24-hour care, and it usually kind of comes and goes depending on the symptom management. What does a hospice admission look like? This will differ from agency to agency depending on how they run their admissions, but they generally take a long time. So I can be at admission, which I do all the time, for 2 to 4 hours sometimes, because it's just a lot of paperwork, a lot of educating, a lot of hands-on head-to-toe assessments, reviewing medications. It can just take a while. Now, depending on how the agency works, sometimes you have a hospice liaison or a hospice social worker come to you first, and they will describe the hospice benefits to you. It's called the BOE. It's like an explanation of all the things that you get when you come onto hospice. And if you agree to it, you may sign the paperwork right then and there, which technically puts you on to service, meaning you're on hospice now. And then a nurse will come out later and do the full like head to toe nursing admission. Sometimes hospice companies do it like that. I happen to work for a hospice company that we do all of that. So as an admission nurse, I will go into the home, I will review all of the paperwork, all of the legal Medicare paperwork that I have to review, and then talk with the doctor, of course, to make sure the patient is appropriate for hospice and that they want hospice. And then we can get all the paperwork signed. And then I move on to the education portion, and then the head to toe assessment portion, and then the medication portion where we're reviewing all the medication they're already on. We will try to take some of that medication off if we don't think it's really beneficial. At this time, it just depends on what's going on with the patient and if we think the medications are going to help manage symptoms, if we need to try to take some of the medication off just to help them not have to take medication 24/7. As you can see, even describing it, you can see how long this can take. It can generally take a very long time. I also, at the admission, usually try to order the equipment at that time. So I'll talk about, do you think you would benefit from having a hospital bed or a bedside commode, a wheelchair, a walker, a shower chair, a Hoyer lift? All of these things we discuss at the admission. If I think the patient needs oxygen, I will also start talking about, should we order oxygen, and then educate about oxygen. It just depends. I'll also at this time make sure we have medications that we may need in the home ordered and ready. So for example, the comfort pack that I talk a lot about. Sometimes no one will ever even open the comfort pack, which is all medications to have in the home kind of just in case. Just in case they wake up with severe pain. Just in case they suddenly start having shortness of breath. We want to have that comfort pack in the house, so if you call at 2 in the morning, there's actually something the nurse can do when they arrive at the home. At the hospice admission is also the time and place when you should be asking all of your questions. Anything that comes up, make sure you ask at that time. And guess what? If you do forget, which you probably will, just write it down and you could always call the hospice company and ask, or just wait for the next nurse visit if it's not an emergency. We'll eventually always be able to answer your questions. Supplies are another thing that I usually order at admission. So I will talk to the family and the patient about the things they may or may not need and what we do and do not cover. So the main things I usually order are disposable bed pads, which I highly recommend. I love them. Gloves, briefs if the patient needs them, sometimes lotions, sometimes no rinse soaps, sponges for oral care, depending on where the person is at in their disease process. It kind of all depends, but there are things we do order. However, I will say Medicare does restrict us. So there's certain things we can supply and certain things we can't. For instance, there's these things called Mepilex. They are great for wounds and preventing wounds. However, per Medicare guidelines, we're not really allowed to order those unless the person already has a wound. So we can't order them for preventative measures, unfortunately. One last thing about the admission. Most hospice companies will leave you with some kind of binder or some kind of like reading material with their phone number and like the names of your team members on there. Utilize that packet. That packet is full of information for you and your family to learn from. So open it up and actually look at what is written in there. A lot of times they give you a lot of different supplies or things to look at, things to be able to kind of keep track of when you gave pain medicine, things like that. So it's a great resource. I would check it out. So who is on your hospice team and how do you best utilize them? And that's the big thing I want to drive home here. Utilize the hospice team. Know who's on it and utilize them. So here is the team, and I'm speaking generally because different hospice companies will work different ways, but this is generalized. So you'll always have a doctor, you'll always have a nurse, you'll always have a social worker, a home health aide, a chaplain, a volunteer if you want, and then a lot of hospice companies also have physical therapy, occupational therapy, and then side things like musical therapists, massage therapists. It just depends. So that's a lot of people that are at your disposal. So utilize them. At that admission, ask them all the people that could potentially be on your team. People will refuse the social worker, the chaplain, they'll refuse the volunteer, they won't take on the musical therapist or the massage therapist, and I really feel like people miss out because they don't think they need it, or no, that's okay. All of these people are trained specifically to work with hospice patients, and they are all amazing. So even though the word chaplain, sometimes people think, oh, I'm not religious, or oh, I already have my own priest or minister who's gonna come by, I really encourage you to utilize everyone on your team. One, you always have a right to refuse later if you want to, but I would say let everyone come in, see how they can help you just to better utilize the program. You are going to need time as a caregiver for yourself, and people on this team will help with that. For example, when the home health aide comes in to bathe your patient, if they don't need help or they can do it themselves, take a break. Leave the room. Go have a coffee for yourself. Maybe not even leaving the house, but even just in the other room. Let them have their time and let you have your own time to give yourself a break. If the social worker comes in to talk to you, ask them how they can help you. Ask them, are there programs you might qualify for? Are things in the community that might help you? Because most of the time there are. The social worker is the person who's going to know about those certain programs and things that you may or may not qualify for. So ask them, they can help you. The number one team member I see refuse the most is the chaplain. They are so underutilized and they are so amazing. They can help with so many things, emotional support, spiritual support, and much more. So please utilize your hospice chaplain. Let's talk about some people that are outside the hospice community that may be able to help you. First, friends and family. Friends and family who are offering help, or, hey, what do you need from me? What can I do for you? A lot of times you don't know what to say. So you're like, I don't know. I guess I'm okay. No, this is the time for all hands on deck. You can even say, I don't know, but show up tomorrow at this time, or when's good for you? After work, can you come over? Utilize people who are saying, hey, can I help you? If you have a neighbor who is saying, hey, can I help you? Or do you need me to make food for you? Just always say yes. I feel like this is the time when accept the help. Let someone come over and watch your loved one while you go for a walk or get some coffee. Any little thing like that can help. So utilize those options if they're coming to you. Also, paid caregivers. If you have the ability to do this and pay someone to care for your loved one, even if it's just for a few hours, a couple times a week, please do so. Caregiver burnout is real and it will happen. And if you have the resources, which not many people do, but if you do, please utilize that and use paid caregivers. You can always ask your hospice social worker if they have any good resources or companies they like to use, and utilize that if you can. In general, if you have a question, don't be afraid to ask your hospice company. I think most hospice companies would rather you call too much than not at all, because if we don't hear from you, we're just assuming everything's okay. So if everything's not okay, call us and let us know what's going on so we can better help you. And please remember that if you are not happy with your hospice company, you can always switch hospice companies. Let me know if you've ever worked with a hospice team and what your experience was, and let me know if you have any questions in the comments.